Yeah, and I want to explore two trends that we are certainly supporting at the National Alliance, but I want to hear kind of your views on it. So one of them is putting more emphasis on what I would term advanced primary care. Why primary care? Why is that a winning strategy, or would you have concerns and go in that direction?
No, I think if you look at other countries where medical costs are fairly well in check, they have a higher percentage of primary care, and that's kind of the quarterback, the conductor of the orchestra when someone is, needing coordination through the healthcare system. I think we talked about it before, is the primary care physician is prime and ready to do this, but they've got to be rewarded and they have to have the time to really help someone navigate and advocate.
Yeah. And there's a sense of connectedness. There was a study in one of the medical journals, oh gosh, probably 10 years ago, about this notion of connectedness. And when the provider was able to connect with the patient, compliance with care was much better, the clinical outcomes were much better. It also seemed that there was some level of, or greater level of satisfaction, both for the patient and the provider. What we know from other studies is that effective use of primary care at a population level results in substantially lower overall healthcare costs for those individuals who are engaged. So there's a compelling business case.
Yeah, it's one of the bright spots I think we've seen in the last 15 years is some of these models emerging, sometimes in on-site clinics or near-site clinics, and sometimes building new clinics in communities. And frankly, we've had some concern, I think, as primary care has gotten bought by health systems, that their orientation is not the same orientation as what we would view as advanced primary care. In fact, well, I mean, have you seen anything like that in terms of any issues?
We do see more churning, so that relationship with the patient is less likely to happen. You may not see the same provider the next time you go to this group again. And so you haven't developed the trust. So are you going to follow through on the recommendation? It really does need to be a relationship. And second of all is it's easier to refer to a specialist. So rather than taking care of the issue, trying to address it, it's like, I have 7 minutes, I'm going to just send you to the gastroenterologist.
I think there's an important point to be made here about those employers that are opting, and Mike, you alluded to it, are opting for third-party entities like on-site clinics or near-site clinics. It almost seems easier for the employers to disrupt the system by contracting with an outside third party where there is no concern or much less concern about a potential conflict of interest. Indy, to your point, are those primary care practitioners that are owned by or salaried by the healthcare system incentivized somehow, subtly or not, to refer internally for additional testing and services, as opposed to a self-contained group that isn't.
Yeah, and I've heard worse stories where great primary care operated within a health system gets toned down in part because it's reducing emergency room visits and admissions, and that's not consistent with the business model. And I think we really have to look at our values if that's what we're about. I mean, if we truly can improve the health of our populations, then why wouldn't we operate with that? Pat, you mentioned before that we're not going to get great primary care if we keep treating primary care the same way we do today.
Right. Yeah, I strongly believe that they have these limited periods of time, and there aren't enough of them.
Right.
And I think they're not choosing it because they're not rewarded appropriately.
Yeah, and so I think there's these new emerging business models to help make that happen. And part of that, I think, is physician extenders and team-based care that allows primary care, allows us to use these professionals at the top of their profession.
How about the impact of urgent care and telemedicine? I mean, we're seeing a very high use of telemedicine, and I think that's good and maybe not so good. So good because it really meets a need, and not so good because it may, in fact, damage the relationship with primary care. And 75% of our telemedicine events have resulted in a prescription. And I'm not always sure that's the answer. So that's a quick answer, and it's an easy answer telephonically. But I'm curious about how our physicians feel around the.
I absolutely agree with you, and we're just starting now to look at some data to understand, is the telehealth that's being used a function of third-party entities that contract with the health plans to provide telehealth services, or is it integrated delivery networks, health systems that have telemedicine capabilities? And I think we're still learning what service, what proportion of those services are being used by which individuals. Because on one hand, you have the potential, as you described, for further fragmentation of care delivery. Retail clinics is another potential risk of that happening. But if there is effective communication with the primary care practices, maybe less of a concern. The other issue is, are we creating or inducing demand, if you will, by virtue of making access to healthcare even easier through telehealth? Some of the early studies of telemedicine would suggest that at least some of that may be happening.
Yeah, and as you talk about urgent care, it's creeping into the chronic care type of thing. So it's becoming episodic. You may not see the same provider all the time. To be honest, electronic medical records are the hardest thing to navigate from a provider standpoint, to find out what that provider was thinking when they were making a decision. So I think we're kind of losing some things in communication. Things are being done over and over again. And so I think the episodic care that we do, it's, as Bruce said, makes it easier access, but not necessarily appropriate access.